After the introductory video for epidemiological approach, now we will go to the main part of the epidemiological approach. So what are these? We have already given one idea. So now I will discuss one by one. So whenever we talk about epidemiological approach, the first thing we were dealing about asking questions and making comparisons. So when we talk about asking questions and dealing with the comparisons, there are two things that is important. So first, for asking questions, the epidemiological has defined as a means of learning or asking questions and getting answers that lead to further questions. So whenever we do a study, we will ask more and more questions and to depth of the study so that we can get new data that can be applied in the study. Okay. So what type of questions that mainly arises? They have given some examples. So during questions, there are two things that is mainly arising. That is the health event and that is the health action. Okay. So when we talk about health events, what are the questions? They have given examples as what is the event? What is its magnitude? Where did it happen? When did it happen? Who are affected? And why did it happen? So these are some of the questions that mainly arises. The next one we talk about related to the health actions. So health actions, if we talk about, then the main thing it mainly arises. It is the what are to be done to reduce these problems. Okay. Then next, how can it be prevented in future? Then next, what actions should be taken by the community or by the health services or by the other sectors, or where or from whom these activities to be carried, and what sources are required, or how the activities that mainly will organize, or what kind of difficulties may arise, and how might they be overcome. Okay, so these are some of the questions that is related to the health event. You will know about the disease and related to the health action. Health means what are the actions you want to take, or what are the things, or what are the evaluations you want to do. Okay. Then next let us see what we mean by comparison. So when we talk about comparison, you know the comparison of two groups. Okay. So the basic approach in epidemiology is to make comparison and draw inferences. So this may be a comparison of two or more groups, having one group with the disease and the other group without the disease, okay? Or a comparison between the individuals. So by making comparisons, the main thing is the epidemiologist tries to find out what is the crucial difference between in the host and the environmental factor between those affected and non-affected group of people. Okay, so one of the other consideration that mainly arises is before making comparison is to ensure what we know by the comparability. So when we talk about comparability, it is between the study and the control group. In other words, the both groups should be similar so that like being compared with like. Okay. So for fact of the comparability, they must be accurate and they must gather in a uniform way. For example, the study of the control group should be similar with regard with their ages or with their sex composition, and similarly with some other factors such as for case in randomization or the randomization localization. So these are some of the things we have to see while doing any comparison of the data. So this was about making comparison and asking questions. So we have to obviously ask some questions for better study or for better collection of data. And the second thing, we always have to do comparison. And comparison it should be with some specific factors that will always make the comparison easier to do in the study. Okay, thank you.